In my opinion, heart rate is the most important vital sign, especially in pediatrics. Heart rates can be elevated for a million different reasons, but by far the most common reason is because someone has a fever. Once the fever comes down, the heart rate should come down as well. And if it doesn't, then we need to do some more investigating. In the pediatric population, kids cry, and crying can elevate your heart rate as well, or anxiety in bigger kids. Even physical activity, walking from triage back to the room, can elevate your heart rate. So a lot of the times we'll put a pulse ox on the kiddo's foot or hand, and we will step out of the room and let them calm down and watch on the monitor outside to see if that heart rate comes back down to normal. Dehydration is another pretty common cause as well. Medications can increase the heart rate, especially something like albuterol. We give pretty high doses for kids that are having asthma exacerbations in the pediatric ER. Sometimes we'll hit them with like 15 milligrams, like when they walk in the door if they're really breathing hard, and their heart rates can get pretty high. Kids tolerate albuterol and tachycardia way better than adults do, so we can give pretty high doses because breathing, it's really important. Younger kids, we start with 7.5, bigger kids, we start with 15. The one you don't want to miss is sepsis. High heart rate is one of the earliest signs of sepsis. We take a lot of heat in the emergency department because people are like, all they did was give us ibuprofen and sent us home. But that was actually a really important step. If you give ibuprofen and the temperature comes down and the heart rate does too, the chance of you being septic or having like severe dehydration is much less likely. Adults and kids kind of look like crap when they have fevers. So getting the fever down and then reassessing the vital signs is a really important step.